Okay, good. So I wanted to let everyone know that it will be recorded. If you know some people that couldn't attend today and wanted to listen later on, hopefully if all goes well, I'll be able to put this link to our website. Everyone is muted today, so the only person you should be hearing is me. If you have any questions as I am presenting today, you can type them in the lower left-hand chat box, the Q&A part or the questions part of the little chat feature on the left-hand side. So you can just type your question, and then we will reserve some time at the end of the webinar to address questions. Some of you submitted some questions prior to the webinar, and I will address those as well. Also, at the conclusion of the webinar, 3 random people will be drawn to win a gift card, a $20 gift card from Amazon. So I will announce that at the end of the webinar. And with that, I want to thank all of you again for joining us today. I want to let you know that those that are attending and those who are invited were specifically targeted, if you will, as to us as to want to recruit you as a new agency. Some of you might have already been a partner agency, but you haven't used our services in a while. So in our world, we consider you former. And so we wanted to refresh some of your memories about the kind of services that we have to offer for the vision care program. Some of you might have been trained as a preschool vision screener. Some of you that are attending might have been trained as an adult vision screener, and that's how we would have got your email to invite you to the webinar today. Our goal today is to provide you with a resource when you have those in need of vision care. I know your time is valuable, so I want to go ahead and we'll get started. So what is PBO? We are a nonprofit public health organization that promotes eye health and eye safety. We advocate that half of all blindness can be prevented with early detection and professional treatment. We are the only statewide consumer advocate for sight conservation. We serve all Ohio and provide direct services to educate over 800,000 Ohioans annually. We also have a vast library of eye health and safety materials, and you can find those materials on our website by searching for fact sheets. We offer workplace wellness programming along with educational exhibits in museums and libraries. We also offer classroom lesson plans. And again, like I mentioned, we also provide preschool and adult vision screening training programs. We also support a scientific research funding by rewarding a student fellowship to female scholarships. We do not receive any government or United Way funding. We rely solely on voluntary donations from in-kind donations, individuals, eye care professionals, eye care corporations, business corporations, foundations, and fundraising. Everything that we provide to our clients is donated to us. Our mission is to prevent blindness and preserve sight. And we promote, like I said, eye health and eye safety. And earlier I said something to you about vision screening trainings for preschool and adults. We provide these trainings to advocate the importance of good eye health and seeing your eye doctor on a regular basis for eye exams. Some of you might be saying, isn't a vision screening the same as an eye exam? No, it is not. They're two completely different things. A vision screening can be provided by a school nurse, can be done in free clinics, community health fairs, other social service agencies, and it's to test an individual for eye diseases or acuity errors, and then we can make referrals to an eye care professional. A vision screener typically is not a doctor. The vision screening identifies the subject that is at high risk for an eye disease, and we ask certain risk assessment questions. These questions can provide valuable information to the public and educate them about their eye care. A vision screening can identify near or distant acuity measures using either handheld charts or a vision screening machine. The vision screening typically takes about 5 to 10 minutes to complete. When someone fails the vision screening, that's when they are referred to an eye care professional. So if a vision screening isn't the eye exam, what is the eye exam? Prevent Blindness recommends everyone get a comprehensive dilated eye exam. This comprehensive dilated eye exam usually lasts about 30 to 60 minutes and is performed by an eye care professional. A comprehensive dilated eye exam should always include a vision history. They examine for vision disorders, eye diseases. They do visual fields testing. In adults, that'd be like the puffer eye test that you get when you go to the eye doctor for glaucoma. They use drops to dilate your pupils. It's important that you get that so they can look in the back of your eye and check for the diseases. And then, of course, they do the refraction, which is actually reading the chart on the wall. When you've gone to your eye exam, you look through that machine. Doctor says which is better, 1 or 2, 3 or 4. And then if you get your eye exam results, either you get glasses or you don't need glasses, or you might have something else that needs further follow-up on. A comprehensive dilated eye exam can be performed by an optometrist or an ophthalmologist. You just heard me say that the eye exam, the comprehensive eye exam, should be done by an optometrist or an ophthalmologist. Is there a difference? Yes, there is. The optometrist is a healthcare professional that is trained and licensed to provide primary eye care services. Basically, these services include comprehensive eye health, vision examinations. They can diagnose. Some can treat eye diseases. They can detect the general health problems. They, of course, prescribe glasses, contact lenses. Some can specialize in low vision, vision therapy, and other medications. The optometrist has completed a pre-professional undergraduate education in college and then 4 years of professional education at the College of Optometry, which is, leading to the Doctor of Optometry, which sometimes you'll see by your eye doctor, the OD degree. Then there's the ophthalmologist, which is a physician, or you might see MD at the end of his name. They are an actual doctor who specializes, again, in comprehensive care of the eyes and your vision care system, or your vision system. And they are there for the prevention of the eye disease and injury. The ophthalmologist has completed about 4 more years of college, of pre-med, and then 4 more years of medical school. They could have and then they'll have a 1 year of internship, and then 3 or more years at specialized medical or surgical training in specific eye care. The ophthalmologist is qualified by lengthy medical education and experience to diagnose and treat all kinds of eye and vision problems. They are licensed by the state board, and they practice medicine and surgery. And again, they can also deliver, total eye care, as in the vision care services, contact lenses, glasses, and then, of course, the medical care, surgical care if needed. Then, of course, there's one more, the optician. What is an optician? The optician is actually the person who is in the field of designing and fitting your glasses. So you go see the eye doctor, they take you into that other room where you see the big wall of glasses there, and you select your frames, and they help with the dispensing and the contacts, and they base it on your eye doctor's prescription. They might dispense colored or specialty lenses, but they're there to help find a perfect frame for your face to wear. But you can go to any doctor of your choice. I actually go to an optometrist. I have confidence in my eye doctor that if they find something during my eye exam that requires further care, they will refer me to the proper specialist. As a matter of fact, my husband goes to the same optometrist as me, and several years ago the optometrist noticed bleeding in his macula, and the optometrist referred him to a specialist for age-related macular degeneration, or AMD. Some of you may be familiar with that term. He received the proper treatment, and he caught it early enough, and he was treated for it, and he can see much better than he could before. So, I wanted to point that out to you, that regardless of who you choose, either one is good, to finding, if necessary, something that might require more treatment. So all this talk about eye health and the importance of eye exam, that leads me to where now Prevent Blindness can help you, and to those of you that serve in your community who can't really afford vision care. We know with the Medicaid expansion, many Ohioans, were afforded access to vision care, but there are still those who cannot afford the eye exam and glasses because they don't have Medicaid benefits, or because they don't apply, or they don't qualify, and those are those that we kind of refer to as falling through the gaps. So there are some who can get their eye exam but can't afford their glasses, and that's where Prevent Blindness can also help through our Vision Care Outreach Program, or VCO as we call it. The VCO program provides free eye exam and glasses to those in need. We serve those with and without Social Security numbers. There is no cost to the individual, the client, that's what we call them, who use our vision care services. We have partnered with several care providers throughout the state of Ohio. We have a wide range of eye care providers and optical companies who donate all their goods and services to us. We estimate the value of their donated products to us, services, about $2 million a year. So that's an extremely generous gift that we have, that they give to us, and that we can give back to those in the community and those in need. Last year, what we did is over 5,000 Ohio children and adults applied through our Vision Care Outreach Program. And out of that 5,000, we were able to confirm that over 4,400 individuals followed through with the eye exam, donated eye exam, or got their glasses, and then some of them actually did need further ophthalmological care. So that's really, fabulous that we were able to do that for those people in Ohio. The Vision Care Outreach Program serves everyone from birth up, and as I mentioned earlier, all of our eye exams and glasses are donated to us by eye care professionals. In our metropolitan areas, such as Columbus, Cincinnati, Dayton, and Toledo, and Cleveland, we have a pool of eye doctors who donate monthly eye exams and dates to us. We also have vouchers for glasses donated to us by One Sight. That is the corporation that runs LensCrafters, Sears Optical, and Target Optical. We also have gift certificates that are good for a comprehensive dilated eye exam and glasses, and sometimes just glasses from VSP, which is called Sight for Students. Those are for the children, and then Mobilize. And again, we have gift certificates that includes the eye exam and glasses for that. And then we also have vouchers, or another gift certificate for if you will, for kids from the VisionWorks company. It's called Let's Go See. Typically, though, those are available in the northeastern part of the state. And then we also have America's Best vouchers, and wherever there are America's Best available throughout the state, we have those available for eye exams. And then we have a staff of 3, including myself, that processes all the applications from around the state. Clients must meet the VCO guidelines to utilize the Prevent Blindness Vision Care services, and that means all clients must meet the 200% poverty guidelines. There's no exceptions to that. They have to meet that. The person must have no insurance that has a vision component. Now, I want to touch on that just briefly. If they have insurance benefits and it doesn't have vision, they can use us. So I don't want anyone to think that just because they have insurance, they can't use us at all. It's if they don't have vision insurance to it, or vision component to it, such as Medicaid, Medicare, or private insurance. Then the third piece that the clients need to utilize to participate in our program is where you come in, and that's clients must be linked with what we call a partner agency, or a participating referring partner agency. A participating referring partner agency means someone who will qualify the client for the program, serves as a liaison between us and the client, and then what happens is you qualify the client for the program, submit the applications to us online, and then you give them the information needed to get their eye exam. A partner agency can be schools, it can be health departments, it can be a church, it can be social service agencies, and the like. The partner agency, like I said, will facilitate all eye exam and materials information related to that eye exam to the client. So it could mean if we schedule an eye exam for the client, we email you and let you know when the eye exam is. Or if you get a gift certificate for the eye exam, we mail those materials to the partner agency, and then it's up to you to get that information to the client. If you can help them schedule the eye exam, we like that. But that's a gold standard for us. We know all of you are busy. As long as you can get the information to them, that's what you do. All of the gift certificates and vouchers for glasses always include a letter of instructions, so it's always outlined in great detail on how to use that gift certificate and what they need to do or where they need to go to redeem that gift certificate for the eye exam and or the glasses. Okay? Typically, we do not engage in direct client services. So at the conclusion of today's email, all of you that have attended, I will mail you a copy, or I'll email you a copy of our Vision Care Outreach Partner Agency Manual. The manual goes over in great detail the Vision Care Program, guidelines, and the services. And if you have this really great service to offer, you might be saying, well, how do people know that I have this? So you can promote your services. You can place announcements on your organization's website or Facebook page. You can place ads in your organization's newsletters or your local newspapers. We have had several health departments do all of the above, and it does generate a lot of interest when they do that. You can hang signs in your facility or your office. We can help you create that. For school nurses, when your students fail your vision screenings that you do for them, you'll know that Prevent Blindness is an option for vision care, especially for those without Medicaid, such as CareSource or Molina. So now you might be saying, okay, this is really great, but how do I sign up to become a partner agency? So in the partner agency manual, there is what we call a partner agency agreement. And all you need to do is, after you read through the manual, complete this agreement and then get it back to us. There's one for adults and there's one for children. The one for adults actually reads Vision Care Outreach Adult Program Partner Agency Advocate Agreement, and then the other one mentions the Children's Vision Partner Agency Agreement. This is just a basic agreement. This is not a contract. It's not binding. It's just so we can get your contact information. You can fax that agreement to us. You can scan it or email it to Prevent Blindness. But once we receive it, we'll have your name and your affiliated agency name, and we'll enter that into our database. We need that because then what happens is you are assigned an agency ID number and then a password, which we will email you. We will email those directions to you on how to access the online portal because we do not accept paper applications anymore. Everything is done online. So you can see on the screen here, that's kind of what you'll see when you log onto the online portal. You'll have your agency ID number, and then there'll be another drop-down that will have your name. You select your name from the drop-down menu, then you click on Continue, and then you can select the application. If you don't see your name on the drop-down menu when you get on the online portal, you cannot submit an application. You must submit applications under your name. So then once you get onto the online portal, you've logged on, and now you can click the link on which application that you want to submit, either for an adult or children. There is no charge to you or to the client to use our VCO program. The turnaround time from when you submit an application and your client receives PBO services is around 14 to 21 days. All communication is typically done via email, and all materials are mailed directly to you, and then the partner agency facilitates that information to the client. It really is that easy. Okay. So now you have this really great resource, and I've told you how the program works, how you get signed up, what you need to do when once you qualify the client for the program. But some of you, I know, work with those that have insurance, and you're unsure of what your client's insurance might actually cover. And and you all know that in order to use our services, the client must not have any vision insurance, and it can be very confusing. It's confusing to us, but we try to be as knowledgeable as we can on this. So we know that the Affordable Care Act, ACA, some of you know it as the Marketplace, doesn't cover eye exams unless someone is paid, for the higher plan, like the Platinum plan. So if you ever serve anybody and they say, well, I got my, my insurance on the Marketplace, vision's not covered, that would be correct. More than likely, it's not covered. And something else that gets a little confusing because of the providers. We know there's CareSource for Medicaid, and there's CareSource on the Affordable Care Plan. So sometimes that gets a little confusing as well. So when someone has private insurance where the exam is covered, there might be a large copay or there's no coverage for glasses, we can step in for that as well. I think a lot of times people have insurance where it will cover the eye exam but it won't cover the glasses, or it only pays for a part of the portion of the glasses. We can help with that. There are several Medicaid plans in Ohio, and sometimes it's hard to find providers that cover both the eye exam and the glasses. So, the consumers, they have to be knowledgeable about their coverage, and that's why we try to be as knowledgeable about the coverage as well. We know that Paramount, CareSource, United Health Care has zero copays. And we know Ohio Medicaid, just straight Ohio Medicaid, has very low copays for the eye exams and glasses. For adults, the Medicaid covers an eye exam and glasses for every 2 years, and then for the children every year. We know that Molina and Buckeye Health cover eye exams for adults and children every year, but there is a copay along with that, but it's a very low copay. It's I'm pretty sure it's like under $20. Then other plans vary. Paramount, CareSource, Ohio Medicaid, Buckeye Health cover. Again, they'll cover glasses every 2 years. The problem is finding, again, the provider that accepts both. So if they have, they have to call their their medical provider number on their card, find out who does what, who takes what, what is accepted. If you do have a client that got their eye exam through Medicaid or private insurance and has trouble getting their glasses due to a copay or allowance, or they can't really find anybody, we're willing to step in there and we can issue them a voucher for glasses. Molina covers the glasses every year, like I mentioned, and United Healthcare covers about $125 towards glasses or contacts. So sometimes that might, be a little problem for some people to get that money together. We do know that those two sources cover children to get glasses every year. If your client has Medicaid and has lost or broke their glasses, they really should check with their Medicaid provider first. They should get authorization to get another pair. So if you have an adult or you have a child, a parent that says, hey, my child has broke or lost their glasses, tell them to call or help them call their member services, the number again on their Medicaid card, and ask for authorization. That's a buzzword to use to get this a new pair of glasses. Typically, we have found that Medicaid will issue another pair of glasses for a child, but we've also found that they won't either. So that's not uncommon to hear that. But if it's the client's off here or they need another pair of glasses and the Medicaid won't cover, won't issue the other pair, then that's when Prevent Blindness can step in and we can issue a voucher for the glasses. Typically, this voucher is actually called a Healthy Eyes Referral Card, and it's good at any lens crafters, Sears Optical, or Target Optical. An eyeglasses only application would be submitted for this when this happens under this scenario, and the date of the eye exam is required on this application. So that means that the client would need to know when they got their eye exam, because they will need a copy of the prescription. So we need to know the exact date, because prescriptions are only good for 2 years. Anything older than that, then the person has to get a whole new eye exam. So that's why it's important that we know, so we make sure that it's an up-to-date prescription. But then once you get that date of that prescription, and of course they would need to get it to get the glasses, they need to go back to where they had their eye exam, and then you can submit that application, and that applies to both adults and children. There are some people that have Medicare, and that's under the adults. A lot of people believe that Medicare doesn't always cover vision, and that's not necessarily true. Most people are familiar with the term Medicare Part A, B, and D, but there are some Medicare supplements, and usually that's when the person is paying extra for extra coverages such as vision or dental. And that Medicare supplement could be a Medicaid or Humana that will cover an eye exam for an adult. And typically these supplements, while they'll cover the eye exam, they'll only cover a portion of cost for the glasses. That's where we can step in. Client can get their eye exam, and then we can step in and get the glasses. Medicare Part B does not cover typically the eye exam or the glasses, but there are kind of some exceptions. Medicare B will cover 80% of the eye exam, and then the client has to pay the remaining 20% out of pocket if they have a family history of glaucoma, African American over the age of 50, they're Hispanic over 65, and have diabetes. Some eye doctors may include the refraction, and again that's reading the chart on the wall. And some may not, but typically we have found that most Medicare will cover the eye exam, and then we can help with the glasses. If you run into any clients that, they say, well, my doctor only does the wellness, because it is technically called a wellness exam, and they charge extra for the refraction, and the refraction is a hardship for the person, we can step in, we'll talk about it or email about it and figure out how we can do and get that person, an eye exam and glasses. Medicare will also cover some of the costs towards cataract surgery. The only one time that Medicare will actually cover glasses is when the person has had the cataract surgery and glasses are needed following that surgery. We have found that most doctors will find a way to bill the Medicare, so a lot of our clients that have Medicare are able to get the eye exam, and then we get applications submitted to us for them to get the glasses. This chart that you see here actually demonstrates the different scenarios that I've outlined as far as insurance coverage that I just discussed. But when you get a copy of the partner agency manual today, that'll be emailed to you. This chart is it's set up similar in the manual, so you'll be able to see that outline and what is covered and what is not. What I'd like to do now is to share a couple of stories that we received. We love getting success stories because we share these with our funders, and they like getting these stories because they want to know what what is their money that they're giving us doing for the people that we serve. So we love getting these stories and sharing them with everybody because it's really important to help keep our program running. So this first story that I wanted to read, this is from a little girl. She is age 8, and it was written to us by her mother, and she says, Elaine had been complaining about blurry vision and headaches for some time. After applying and receiving our voucher for Sight for Students, we made an appointment. She does need glasses for focus and relaxing her eyes. I appreciated prompt and the no fuss to it. It was to receive it and to use the voucher. Right now we are trying to make ends meet on a tight budget, so this voucher is a great blessing to us. Thank you for making this program and this gift certificate available to us. And then we got another success story from a woman who's 44 years old, and she says, "Hello, I want to thank you for helping me to see better. I am on disability and don't have vision insurance. I would not have been able to get a vision screening and glasses without your help. My vision had gotten so bad that I now need bifocals. I had gone so long without eye care. I was having such a difficult time seeing. It would take me longer to fill out forms, and I couldn't see the signs until I was really close. I am very thankful for your organization. Yay, I can see again. This has lifted a huge weight off my shoulders. Thank you again." Okay, so I've gone over how the program works. I've gone over how you sign up. I've gone over what the insurance is. Different scenarios on that. I'd like to open it up now to any questions. You can type them in the question lower part there, like I told you, and we'll wait just a couple minutes, and if anybody has any questions, I can address them. I did get, like I said, I did get a question prior to the webinar, and I'll be able to read that in just a minute, and then we can, I can go over the question. So yes, if you have any questions, please type them away. The question that I did get was, I have been associated with Prevent Blindness for a while now. The school system that I work for was able to get assistance for students, but now that health care has been mandated, there are fewer students who do not have insurance and fewer doctors who take government-subsidized medical insurance. I feel like I have fewer students who are receiving proper vision care who I send referrals to than before the health care was mandated. How can I help those students who aren't eligible for the gift certificate or for our program services and are falling through the cracks? That's a good question. I think, because we know there are people that we can't reach. We try to do the best we can. I think when you're working in a school and not necessarily let me rephrase this. So the school, I think we have found that the personal, and I'm going to use the mother as an example here, we have found that a personal connection between the mother and the child's teacher is a good way to communicate on this issue. So whereas, if they haven't signed up, or, that might be the case, or they can't, fewer doctors take. I think a lot of doctors do take the Medicaid now, but I think if it was me, I think we assume that when the mother goes and they drop the child off to school and she walks them into the classroom and sees the teacher, maybe in a parent-teacher setting conference, the teacher can speak to the mother about the child that's in need of glasses. So if the school nurse sees a problem with the child, go to that teacher and then have that teacher talk to the mom or dad or whomever and say, hey, there's an issue with this child's vision. We think that they need to get an eye exam. I think it's just better because the teacher has that better relationship with the child more often than the school nurse. And another thing too, now that I'm actually kind of talking this out, I'm thinking that, I don't know how many of you have ever heard of the Lions Club, but the Lions Club is a civic organization, and their mission is hearing and sight, and they can help in ways. And so like this person mentioned about the government-subsidized medical insurance, maybe reaching out to your local Lions Clubs and see if they can help with that kind of vision care and glasses. A lot of them set aside funds and money to help people that can't afford it, or might fall through the cracks, or can't get the vision insurance otherwise. But if you ever have those kind of questions, or need some help or other resources, we never turn anyone away. If we don't know the answer, we find an answer, or if we can't help them, we find a way to give them an answer, because we don't want to leave anybody hanging. So you can always email us that kind of information. Okay, so I just got a question that says we are an outpatient mental health agency throughout Cincinnati and lots of providers and sites that offer services. Should every provider sign up to be an agency representative or multiple contact as a point person? And that is a really good question. If the agency itself is already in our database, then you can be just the point person. So what I mean by that is anybody who wants to submit an application, we need their name in our database. So say for instance, we have an agency in Columbus called Alvis House. We have more than one location of an Alvis House throughout the city. And we have them in our database, but anybody from one of that location, we put that person's name under that location. I would prefer that each person sign a partner agency agreement and then we can put them in, but I'm also not so hardcore about it that if you think you might already be in the database and you want me to put you in there, I look your name, or I look up the agency name, and then I type in, I enter your name, your contact information, your email, your phone number in the database, and then I would send you the appropriate materials. I would probably still send you the partner agency manual if you didn't already have it, and then I'd send you the link to the webinar and then the agency ID number. So it's really good to, like the person said, if there's multiple points, we can have as many contacts under one agency as we want. We have another agency, again in the Columbus area, and they have, I think we're up to like 25 people listed in that record who has been given access to sign up or to make vision, what I like to call vision care referrals. Okay, hopefully that answers your question. Does anybody else have any other questions? It doesn't look like it. That means I was good at my job, so I'm very proud of myself. I'll pat myself on the back. What I'd like to do now is to announce the winners of our webinar, or excuse me, announce the winners of the $20 gift card. And those winners, you'll be emailed the gift card. And the winners are Gail Lance, Jennifer Rogers, and Angela Howard. So I will be emailing you. Congratulations. I want to thank you all for attending today. And if you have any questions, you can email me. My email here is on this last slide here, my phone number. You emailed, I think you got my email several times before. Some of you still receive my emails even though you're not as active. But anyway, if you have any questions, I want to again thank all of you for attending today. As you exit out of the webinar software, there's a little survey that will pop up. If you would do me a favor and complete the quick survey as you log off, that would be really great. Let me know what I did bad. I can take it. Let me know what I did good. And just remember, you only get one pair and no spare. Thank you very much. Bye-bye.